Hi everyone, welcome back to my channel. If you're new here, my name's Janice. So today's video, I'm going to be reviewing something that is a really cool product that I've tried recently, and this is related to health and dental. So if you haven't been on my channel before, I've been a registered dental hygienist for over 14 years, worked in the dental industry for longer than that, and I have some other videos here on YouTube, which I'll link below, on the importance of proper breathing. So we all know that we can breathe through our mouth and our nose, but it is very critical for our overall health, our dental health, and our appearance to not be breathing through our mouth habitually. So here is an image that I love to show my young patients or the parents of young children in my office at work. So the top two pictures indicate a healthy individual who breathes properly through their nose. The bottom two pictures would indicate what that individual would look like if he was habitually mouth breathing. So you can see there is a good definition in the first person's cheekbones, straight teeth, wider face, alert eyes, straight nose, good sized airway, as well as a well-developed jaw. We can probably all agree that the first images are a universally more attractive person, but more importantly, the individual is healthier. You can see in the bottom images of the same person, he has poor definition of his cheekbones, crooked teeth, a narrow face, tired eyes, crooked nose, a smaller airway, and a set back jaw. Tongue position is largely responsible for the normal growth and development of the face and jaws. The tongue is a very powerful muscle and should rest against the upper palate or roof of your mouth and cause the upper jaw to broaden and grow forward in a healthy and aesthetically appealing manner. When that does not happen because of mouth breathing, open mouth posture, or tongue tie, the mid-face of a person does not grow properly and the lower face narrows and elongates. Not only do mouth breathing and poor oral rest posture cause changes in facial growth, they also impact the child's long-term health because the jaws, palate, and airway develop abnormally. This can lead to future TMJ issues, current or future obstructive sleep apnea, chronic illness due to poor sleep and body's inability to properly rest and restore, headaches, shoulder and neck pain, poor posture, dental problems, and decreased self-esteem due to the impact on the appearance. As you can see in this picture, the bone that is highlighted in green is the maxilla, or the upper jaw. So it is much more than just the bone that holds our teeth. The maxilla is the entire central portion of our face. It determines our nasal cavity, our airway space, our cheekbones, and the position of the mandible. Consequently, the proper development of the maxilla is essential to both health and beauty. You can also see the top portion of the maxilla. It serves as a base for the eye socket. So if somebody's maxilla is not properly formed, sometimes their eyes can appear sunken in. So the product I'm going to be showing and reviewing, demoing to you today is called Myospots. So Myospots were made by a holistic dentist in Australia, and I'll link all the website info as well as their Instagram, their Facebook down below. But essentially what Myospots are, they're a biodegradable little adhesive pad that you place on the roof of your mouth. And what that encourages your tongue to do is to touch those little pads that you've stuck there as a little indicator point. So it lets your tongue know where is the correct position that your tongue should be resting. When your mouth is at rest, so when we're not speaking or eating, lips should be together, tongue to the roof of the mouth. Teeth in the back should be either lightly touching or slightly apart. Everybody's mouth is a little bit different. So for example, if you hired a personal trainer and they were telling you to do walking lunges across the floor, and they said, I want you to lunge until your knee hits the floor each time. So when your knee hits the floor, that's an indicator, okay, I've lunged deep enough, I can come back up. So that's essentially what this little Myospot is acting like. It's an indicator for where your tongue should be resting. So these Myospots are a form of orofacial myofunctional therapy. So what that big word means, when you hear the word orofacial, I'll just break it down into simple terms. Just think of anything to do pertaining to the mouth and face. And myofunctional is basically related to the function of the muscles in and around the mouth. And usually often it's referred to in dentistry. So a myofunctional therapist is someone that you can see in person or online if you can't find one around where you live. Often they've worked in dentistry and have just went on to further their education in this topic to be able to treat clients specifically with helping them with exercises that assist in strengthening the muscles that are used to swallow, to speak, to breathe properly. So they can help people that have issues with thumb or finger sucking, mouth breathing, tongue thrust, difficulty swallowing, sleep apnea, snoring, speech disorders, oral malocclusions, and also to help prevent the relapse of a lingual frenulum. So basically, the Myospots are a myofunctional tool that can assist in strengthening the tongue, the cheek muscles, and just to encourage a better habit overall. I really love this product. This is the first time that I've ever seen something like this. I was really excited when the dentist reached out to me that developed this. I was really interested to try it. Myself, my boyfriend, some of his friends tried it. We were all really impressed with how long they stuck on. I would say mine take around 75 minutes to completely dissolve. So Myospots right now are $45 in Australian currency, which is similar to Canadian currency right now, or about $34, $35 US. Right now, they do have a 20% off coupon code that I will link in the down bar. Also, you can check out their Facebook page. Possibly in the future, they might have more discounts. You can also buy them from Mile Made Easy, which is a US partner, and they retail for $37.95 US. So depending where you live, try both. See what gets you the better discount. I would suggest buying 2 bottles at the beginning. That way that you have enough spots to fully complete your treatment. You might have a little bit left over, but they have a long shelf life, and then you can always use them occasionally in the future just to make sure your tongue is in the right position. Just because over time, if you're not really practicing, not conscious of it, your tongue can get a little bit lazy. So I definitely get 2 bottles. So I've showed this in some of my other dental videos, but I'm going to show you a little trick, what I would tell to patients to get your tongue into the right position. So when our mouth is at rest, our lips should always be together, tongue to the roof of our mouth, teeth should be slightly touching in the back or slightly apart. Everyone is a little bit different. But most importantly, I don't want your tongue resting on the back of your teeth. Your tongue is a very strong muscle, and it has the ability to shift and push your teeth forward. Especially your front teeth only have one root. They can move surprisingly very easily. So it's very important when your mouth is at rest not to be sitting there with your mouth open or your tongue touching your teeth. So anytime you are not eating or drinking or speaking, your mouth should be in this position. If you're not able to get it into this position, there might be some other issues going on, which I've mentioned in previous videos. We won't get into that. But to get your tongue into the right position, do this little trick with me. So make the little clucking noise right before your tongue makes that noise. That's approximately where I want your tongue to sit. So pay attention. The tip of your tongue shouldn't be anywhere near your teeth. Right behind your upper front teeth, you're going to feel those little bumpy ridges slightly. Those are the rugae. So I want your tongue approximately a little bit behind there. Okay, so that's important to know because when you put this little dot on, I want you to put it behind your upper front teeth on the palate, but I don't want the little dot so close to your front teeth that your tongue's going to be resting on the teeth. That's a big no-no, okay? So practice that a few times. Kind of think in your head, okay, this is where I want my tongue to be when I'm placing the dots on. So a lot of times people have no problem getting the front part of their tongue into the right position, but it's hard to keep the suction, the back half of their tongue, up to the roof of the mouth. So make that noise. So there's where the dots come in. So you can start by putting one a little bit behind your upper front teeth, and then you can put a second dot much further back, and then that will really encourage you to keep the back half or back 1/3 of your tongue up. That makes the biggest difference in your appearance and the strength of the muscles, you're really going to notice a big difference. You might have a little bit of, muscle soreness because you're doing something that you're not used to. So I spoke with a dentist who designed these. So at the beginning, he would suggest you place one spot behind your upper front teeth. Remember though, I don't want your tongue touching your front teeth at all. And then once you get used to that, maybe after a few days, you can put a second spot further back. And that's really going to encourage you to get the back 1/3 of your tongue up to the roof of your mouth. That's really going to make the biggest difference. So I'm going to try to, it might be a little bit hard to see in video. If I can't do a video, I'll try to take a picture or I'll make a diagram here on the screen where I want you to place the dots, because it can be maybe a little bit tricky or confusing if you're not in the dental field, you don't really know what you're doing. So I will try to make that as clear as possible. Okay, so I'll show you how to use it. So I have one, you just take it on your thumb. So it's in place. You can see it. Then I'm gonna put one further back. And I'll try to take a photograph because that might be a little bit easier to see. So on the roof of my mouth, you can see the midline, okay? You're gonna put this in the midline. And sorry, it's a little hard to talk with them on, but this was a good indicator to me because it let me know, okay, I do put my tongue into the right spot. I already knew that I did, but this just reassured me. So I'll try to show you with both the spots. If you need to take them off a little earlier, you can simply wiggle your fingernail under and get them off. Take them off very gently because they are stuck on there. You don't want to irritate the soft tissue when you're taking them off, so don't rip them off if you have to take them off early. There we go. So I'll go over with you some frequently asked questions that people might have about the Myospots. So what are Myospots made out of? The main components are a mixture of algae agar, cellulose gum, and xanthan gum. In addition, they have a few other natural ingredients. You can read about this on their website. Do they contain sugar? No, there are no sugars in Myospots. The sweetener uses stevia, which is a very safe, low-calorie natural substitute for table sugar. I have multiple allergies. Are they suitable for me? So Myospots do not contain any gluten or other allergen-causing proteins, soy, or dairy products. So yes, they are suitable for celiac patients and those who are allergic to soy, dairy, and nut products. Are Myospots suitable for vegans? They do not contain any animal-derived products, so they are also suitable for vegans as well as halal and kosher product users. So how long does it take for a Myospot to dissolve? So it approximately took mine about 75 minutes to dissolve. If you need to take it off a little bit earlier, just take your fingernail and wiggle gently or drink a little bit of water to help loosen it up, just to pop it off early. If you notice that your Myospot is on there for a couple hours, it still has barely dissolved, that's probably a good indicator that your tongue is not making the proper contact with it. So it's a good indicative tool. So can you eat or drink when they're on? I would suggest not to. You could take a sip of water if you need to. It's probably not going to affect it too much, but definitely don't eat. Otherwise it might pop off and you don't want to waste it. Can I sleep with the spot on? No, don't sleep with it. Don't do any physical activity. You would not want it to become dislodged. Even though it sticks on there really well, you would never want to aspirate it. So just don't do that. Can young children use these? So children can use the Myospots. However, they recommend adult supervision for those under 6 years old. Practitioner discretion is used to recommend the use of Myospots under the age of 2 years old. Individual assessment should be sorted to determine the suitability of babies in this age category, and they do not recommend the use of Myospots for infants under 1 year of age. An adult needs to help the child to attach the spot and make sure it is adhered well to the palate. The first 2 to 3 minutes of use are the most critical, as the spot needs gentle force towards the palate for 10 to 20 seconds to attach. After this, the tongue maintains the position of the Myospot against the palate. If you're helping a child use this, just let them know that it will go away. It's not going to be there forever on their mouth. It might feel almost like a little candy or a pill is stuck to the roof of their mouth. Try to encourage them not to obviously eat it or lick it. You're basically just sandwiching the Myospot. So this is the roof of your mouth, the little spot, and then your tongue. So you're sandwiching it. You're not licking it or trying to knock it off, nothing like that. So just, I know how kids are, so just make sure they know that. So how many spots should you use every day? So in most cases, they recommend using 3 spots per day. So can Myospots cause pain? So in some cases, especially in adults, the sudden training of the weak tongue muscles can cause tongue muscle fatigue. This can result in pain in the tongue and surrounding tissues. In this situation, we recommend reducing the number of Myospots to 1 per day at most. When the tongue muscles strengthen, the pain should subside. So it's just like, if you go to the gym and you start doing a bunch of new exercises, you're going to be really sore maybe the next day or 2 days later. So eventually, though, once you do those exercises, you're going to get better at it. The muscles will strengthen. You're not going to be in pain anymore. So the longer you haven't been using those muscles, the more painful, right? So you don't use it, you lose it. Probably after a few months, you're going to have trained your tongue and strengthened the muscles in your tongue and your face to stay in the proper position. So that's pretty amazing. Just maybe after using these 2 or 3 months, you might have changed your health for the rest of your life or your child's health. I just feel you can never put a price on your health, so I would definitely recommend this as a tool. If this doesn't work for you, this might be an indication that something more severe is going on. You might have a blockage in your nasal passage that's not allowing you to get air up there, and then I'd suggest maybe, seeking out medical attention from an ENT, your medical doctor, but definitely get to the bottom of it, because we should be able to nasal breathe. Like always, if you have any questions, leave it in the comments below. Feel free to email me or message me on Instagram. You can also reach out to the company. They're very nice. I'm sure they'll get back to you as quickly as they possibly can. Thank you guys so much for watching. Bye.